Hello everyone, I am Dr. Fong. I am an adult neurologist from the University Malaya Medical Centre, Kuala Lumpur, Malaysia. Do you have drug-resistant epilepsy or difficult to control epilepsy? If so, you might have heard your doctor mention something called stereo EEG, SEEG, or in full, we call it as stereo electroencephalogram. This is part 1 of a 3-video series on all you need to know about stereo EEG. It sounds very technical, but essentially it's all about understanding your brain better. So when seizure happens, we need to find exactly where it starts. It's like tracing a spark to its source. So SEEG is an invasive procedure, specifically for patients with drug-resistant epilepsy. So what is drug-resistant epilepsy? Meaning you have persistent seizures after you have tried 2 or more medications at optimal dose, and it's also used in certain type of drug-resistant epilepsy where the source of seizure is very close to a functionally very important area in the brain. Your doctor will decide that you will need stereo EEG after a series of investigation, which we collectively call them as the phase 1 evaluation. These will include a long-term EEG monitoring that is usually a 2 to 3 days prolonged EEG recording, an MRI brain, and also a PET scan of the brain. So stereo EEG uses very thin wires, we also call them as electrodes, to see your brain's signal from the inside. So this is an example of an SEEG electrode. So you can see it is actually very thin. It looks like this. Your team of doctors will decide how many wires you need and where to put these wires. So the recordings from the stereo EEG will help the doctors to build a 3D map of your seizures. This will guide us to design an effective and a personalized treatment for you. I will talk about what happens during the procedure in the next video.